Well, basically, we're looking at the data and we're listening to community.
Michelle Miles, head of the Office of Violence Prevention, says roughly 6 months in, they're still gathering intel. Things like which parts of Austin see the most gun violence, what do the cases have in common, what's the makeup of the neighborhoods, and what's the best way to use a public health approach for intervention and prevention.
Treating gun violence as a disease.
City Council member Allison Atler spearheaded the office. She says treating gun violence as a disease means not just arresting people and confiscating weapons, it also means putting resources toward mental health and drug addiction, as well as support for those caught in the gunfire.
Hurt people hurt other people, and so you try to get to those folks when they're victims of gun violence, when they're at the hospital, etc. Provide them other tools for addressing conflict.
The office says it looked at what's worked in other cities, including Baltimore, Maryland, Milwaukee, Wisconsin, San Antonio, and Louisville, Kentucky.
La policía caminaba, los veíamos caminar.
Juan Cano owns a Mexican candy and piñata shop along Rundberg Lane, an area city data has labeled a hotspot for violence.
Pero 2016 entró una campaña, 2016-2017.
He says following the 2016 Restore Rundberg initiative that saw more community policing in the area, things actually got better, and he'd like to see it stay that way.